I'm excited to jump right into this today. This show is all about helping our kids. We've discussed so many great topics, but all the while, we were starting to notice in our own practice more and more calls from parents looking for help with their children. And then we discovered Jane Goulding. What if you could be empowered to help your child achieve self-confidence and inner strength in a safe, gentle, non-intrusive way? What if you could enhance your child's self-esteem to make life a more positive experience? Imagine the possibilities. Sleep Talk is a powerful self-help program developed by educator, speaker, and hypnotherapy professional Jane Goulding.
Joane.
Parents and child care professionals have been using it for more than 30 years because it works. It's all about giving emotional hugs to our children and not just physical hugs.
Since 1974, Joane has specialized in the psychosocial aspects of stress and mind management. Her professional qualifications include clinical hypnotherapy, counseling, psychotherapy, psychonutrition, training, and assessment systems.
She's the author of the 2-year government-accredited Diploma of Health Clinical Hypnotherapy and is currently registered on the Australian National Hypnotherapy Register.
Joane is an international lecturer, a published author, and creator of the Goulding Sleep Talk for Children process, proven to be effective in over 30 years of practice.
Hi, Joan.
Well, thank you. That was fantastic introduction. I was going to have to live up to that. So thanks, guys. It's lovely to be talking to you both.
Why don't you just tell us right off what the Goulding Sleep Talk process is?
Thanks, Lynn. Well, the Goulding program is about presenting a safe, non-intrusive, and ethical process for parents to use in the safety and comfort of their own home while their child or children are asleep. And it's very easy to apply. And guys, they don't answer back when they're asleep, which is always a plus in my book. It's about developing their child's emotional resilience because all children benefit from developing a positive and confident sense of self. I guess the process develops this without disturbing the sleeping child, allowing them to awaken in the morning with a more positive mindset. And it only takes a few moments to present, and I call it the 2-minute gift that lasts a lifetime. And changes to their behavior and the ability for them to deal with their world becomes quite apparent after only a few weeks of implementing the process. And guys, I also call this happiness insurance for parents, which I think is very, very much needed. Perhaps the best way for me to explain what the Goulding process is about, guys, is to share with you my case history. The story started way back in 1966. Makes me feel old, actually, when I say
You're in good company.
Yeah, that's good. When my daughter, Michelle, was born in England, when she was about a year old, I gave birth to my second daughter. And about a year later, I knew something was wrong. Michelle was not developing as she should because she was learning from her younger sister rather than the reverse. So why didn't the doctor or anyone else seem concerned? And all they told me was, well, there's nothing wrong with your child. She's just slow for her age. Don't be such a worrier. She'll be fine. Just give her time. And although really desperate to believe the professionals, I knew my little one was not the same as others. So 6 years later, I was still trying to find an explanation for Michelle's difference. But now I was dealing with the expert opinion that I was Michelle's only problem and that there was nothing wrong with Michelle that good parenting couldn't correct.
Well, that must have been horrible for you.
It was awful, Lynn, and I'm sure your listeners would understand that my feelings of inadequacy and despair were absolutely overwhelming. So when Michelle was eventually diagnosed as suffering cerebral palsy with an approximate IQ of around 45, emotionally disturbed and with a speech impediment caused by dyspraxia of the throat, I really felt as though I was drowning in a confusion of emotions. I was at once shocked, devastated, angry, and yet, you know, there was that level of relief as well.
Right. Yeah.
Absolutely, Jim. After years of trying to be a better mother, wearing the guilt of inadequacy and not knowing how to do it any differently in those days, at least I now knew that I hadn't created this terrible problem. my little Michelle. I now knew that perhaps there was some way we could manage her condition now that it had an official label. And don't you love labels? Goodness me, they're so... Anyway, I won't even go there.
That's another program. That's a whole program right there.
You got it.
So you created this program out of necessity.
Absolutely.
Urgency.
Yeah, my determination to find a way became more focused as I listened to the doctor's advice with regard to managing Michelle. I wasn't going to allow Michelle to be sedated and housed in an institution because her behavior was unsociable. So I started thinking, what could I do to calm her anger, to assist her to walk, to learn, to walk properly, to help her speak and cry and laugh like other children. I didn't know how I was going to do this, Lynn, but it was clear to me that the way to tackle this problem was to somehow change her deep sense of I'm not okay, and to give her a feeling of real worth. And so the dream of my daughter finding happiness and being able to live her life independently became my absolute obsession. I created this dream as if I were painting a picture, adding things as they seemed right. And in this painting, Michelle talked and walked, and she ran without falling over, and her world was happy and loving, and she experienced the joy of love and marriage. And gradually, as I worked out strategies, those dreams became definite, confident, definitive, and very purposeful. So the process we developed as a result was made possible because my need was so great, my determination was mighty, and I'm a Cancer, guys, so, you know, I won't let go of anything.
Were you a hypnotherapist?
I'm the crab. I hate letting go of anything. And I had two wonderful helpers from two mentors. One was Michelle's stepfather, the late Jim Goulding, who believed passionately in the power of the mind and its creative mechanism. The other was the author of a slim little book simply called How to Practice Suggestion and Autosuggestion by Emile Coué. Yeah. The realization that it might be possible for my dreams to come true was one of the most profound experiences in my life. And the dreams, make-believe, and imagination are always the first step towards realization, as we now know as hypnotherapists. I refused to believe that there was no help for Michelle, and I started to say and ask, what if? I rejected the negative suggestions of the professionals as I planned and investigated alternatives. In my opinion, I activated that oldest law of the mind. If you can imagine it, you can become it.
Absolutely. And how did your daughter respond over time?
Superbly, Lynn, and I'm going to give you all of that information. You always get someone asking me that question before I've had a chance to show off.
Well, you'll have a chance to show off in a minute. We're already at our first commercial break, and that's the perfect place to stop. You've just really laid this out for us so we can look forward to learning how to do this.
The procedure that we now call the Goulding sleep talk process was perfected over a period of 2 years, and it was so simple yet so dynamic. It changed our entire world. And yes, we made mistakes and sometimes became fearful of failure, but as we learned from the mistakes and refined the procedure, we really were rewarded with a miracle. Michelle still has an intellectual and emotional IQ of around 45. She still has to deal with the physical impairments of cerebral palsy and dyspraxia. However, Michelle now has the most precious gift I could ever give her, the belief that she was loved, she was lovable, that she could walk, that she could talk, and that life was happy. And her deep subconscious belief that I'm okay, that life is happy regardless of individual circumstances, became the foundation of Michelle's world. The belief that I love me and you're okay too became the controls which directed her conscious mind, and Michelle developed a positive I'm okay attitude which never lets her down. And the result of this process, the Goulding process, allowed my daughter Michelle to enjoy life to the full. She is now 46 years of age. She's been happily married for over 22 years, lives independently with her husband, can cook you a mean breakfast just as long as you like eggs, but if you're not, you're on your own.
That's an amazing story.
In the evening, the child goes to bed, and what happens
Well,
after that?
that is, the process is so simple, Jim, that the parents can be taught this
Right.
within about 5 or 10 minutes. And actually, there is a book that your listeners can get some information from on the website. So, but you know, neuroplasticity is really what we are developing here with the sleep talk process, and it empowers the parents. Well, last year I read a book written by Dr. Norman Doidge, and his explanations gave me a deeper awareness of what I'd actually developed. He was writing about the same process that we activated way back in the early 70s when Michelle was having so much distress. It really was a duh moment for us when we formulated a process called the top hat process, which really is in answer to your question, Jim.
Yes.
And when I read the book, written by Norman Doidge, it allowed me to realize that we were actually dealing with back then when we developed this process to assist Michelle. In the 70s, when we were developing this, documented medical research was just starting to be published, which recognized that even when a person was in a coma or perhaps under anesthetic, there was always a part of the mind that still functioned or was still aware or able to listen. So when researching this, I found that medicine has called that part of the brain the reticular activating system, or RAS for short. The realization that it was Michelle's brain that was damaged, not the subconscious mind, was actually very profound. So we started to understand that when Michelle's memory was stimulated without critical analysis, the information stored in the deep subconscious mind became available, and the memory found its own pathway into a conscious brain without distortion. So neuroplasticity is a subject that greatly interests me, Jim. I came across the book written by Doidge in 2010. It was published in Australia, I might note there, guys, by Scribe. And the title is The Brain That Changes Itself. So Dr. Doidge has a very impressive background. He's a psychiatrist, psychoanalyst, and researcher on the faculty of the Columbia University Center for Psychoanalytical Training and Research, which is actually based in New York. And he's also a member of the University of Toronto's Department of Psychiatry. So he has quite an impressive background, actually. And in the book, he talks about a fundamental brain property that he calls neuroplasticity, which is about redesigning the brain. And he considers the idea that the brain can change its own structure and function through thought and activity, which he believes is the most important alteration of the brain. And I wish that this information had been available in the 70s when we were searching for assistance for Michelle, as it would have made such a difference to us all. So, mind you, perhaps sleep talk wouldn't have been developed if this was so. So recently I had the pleasure of meeting the American author, Dr. Joe Dispenza, who states in the book, Mind is the Brain in Action. And I've really enjoyed his book, Breaking the Habit of Being Yourself. He's just recently actually visited Australia, and it's very interesting speaker, Lynn, and I know that you've spoken to him, and Dr. Joe quoted something that actually to me was actually very, very profound. He quoted Aristotle, and Aristotle said, "We are what we repeat daily, so excellence therefore is not an action but a habit." And I was so very impressed with this. Okay, well, most parents usually actually use the process without realizing it already, Jim. They visit their child's bedroom to say goodnight or check that all is well most evenings. And this is the time that the process is presented, just after the child has gone to sleep, when they have a much slower brain wave frequency. And I call the technique the top hat process. Look, sometimes children can overcome bedwetting overnight. And so the primary role of the Goulding sleep talk process is to allow is to allow the little child to accept or re-establish a positive belief structure as truth. So replacing accepted negative suggestions, and this is most important when dealing with trauma, stress and separation anxiety, and especially when dealing with physically, emotionally or intellectually impaired children. So the central issue must be the acceptance of suggestion without conscious critical analysis during sleep. So without awakening the child or causing conscious confusion. And at the same time, it's necessary to make sure that you're accessing the subconscious mind at brainwave level, ranging from deep alpha to the light theta. It's important that when your child it's important to work with the little one when they're not in the deep sleep level of delta, for instance. So achieving the correct level of brainwave frequency, yet not interfering too much with the normal sleeping habits of your child, is the major objective. So without using an EEG, or it's difficult to access the absolute frequency or indeed be 100% sure that you're working at the most appropriate level. So an indication of depth of awareness has to be obtained. So in actual fact, your child's movement during the process is a consistent indicator that the transference to the lighter or more appropriate level of electromagnetic cycles per second has occurred. So the top hat theory was developed, which is a very simple process that allows parents access to the most appropriate brainwave frequency of the sleeping child. And we know that whilst asleep, the conscious mind rests, but the deep subconscious mind always has a level of awareness. And the correct term used to explain this is the reticular activating system, the RAS. It's as though the subconscious mind has an antenna that tells you to wake up, and it's the antenna of your subconscious mind. For example, when your child or baby cries out in the night, as parents will awaken, even if they're 2 doors away, and yet you can remain asleep when a car backfires as it passes the house. So as part of the Goulding process, you direct the little one's conscious mind to stay asleep by communicating with your child's subconscious mind via the antenna. And for the process to be effective, it's imperative to engage the correct brainwave frequency of the sleeping child. So in other words, you take off the top hat, the conscious mind of your child, by saying specific words. I nearly told you what the words were then, Lynn. Your listeners are going to have to buy the book if they want the actual words.
Okay. Can you explain to them a little bit about what happens when they walk into the bedroom? What are they looking for and doing?
Yes, well, most children sleep soundly, hopefully. If they don't, the sleep talk process will help. But it's about making sure that one is fully asleep before the parents actually walk in to the actual bedroom. And many parents now go into their little one while they're just dropping off to sleep and kiss them at night and say happy dreams. And that is actually, in fact, a very similar process to the sleep talk process. And all children benefit from this process. And I think that's the key to this. Number one key is that it's simple. It's very easy for the parents to present. It gives the parents a sense of self-worth, and all children benefit. The child doesn't have to have a problem to benefit from this. And the question may be that the parents might want to ask is, would all children benefit from this process? And most children have problems, so yes would be my answer to that, Lynn. And some parents often say, but my child doesn't have any problems. However, sometimes children don't share their problems or issues with anyone, especially not their parents. I know I didn't share mine, and I think many children in this day and age are the same. So one of the main advantages or additional aspects about giving this process and applying this process is the education that parents gain about the use of positive language. And the downline ramifications of change that occur within the family unit, it can be quite profound as the process commences to be taken on board. And another fantastic benefit, Jim and Lynn, the children in the main, as I said before, don't answer back when you're presenting the suggestion. So everybody wins.
That's great. When you talk about negative statements that parents sometimes make, what would you say are some of the worst examples that parents sometimes say to their children?
Oh, Jim, there are so many. What a great question. Most parents that I've talked to admit that sometimes they say things to their child that they don't mean or later regret saying. And according to one of your American psychotherapists, Antonia Vandermeer, a parent's temporary loss of control may unfortunately mean permanent heartache for the child. And Vandermeer states that sometimes when parents come home tired and irritable and discover their child or their daughter or son has again left their books for homework at school, even the most understanding parent may find themselves blurting, "How could you be so stupid? When are you going to learn to think?" Or perhaps taking the children on holiday and all they do is fight with each other. And even the most patient parent might ask aloud, "Why did I ever have children?"
I grew up in New England, and they were always telling me they were going to give me back to the Indians. They did. I heard that all the time growing up.
Well, that would have been a benefit for the Indians then. Well, Vandermeer suggests that all parents are bound to lose control occasionally and lose sight of the fact that their words can make a child feel wounded, rejected, or unloved. And he suggests that whether menacing, negative, or hostile statements are said intentionally or just slip out, the result is always the same. You know, and as a parent, you might feel perhaps temporary relief, but real damage may have been done to your little ones. And the bond of trust. So it's important to recognize and resist saying hurtful things. And Vandermeer developed a list of statements that are often used by parents. And I think they can in fact be most harmful. And you know, guys, as parents, we have all made mistakes when communicating, especially to our children. We all learn. We all need to learn from those mistakes. I've made them. We've all made them. We need to forgive ourselves and take the learning. And I do hope you guys and your listeners would excuse the next word, Lynn, because I really do say it as it is. I am Australian, so I'm sure you'll forgive me. You know, leave the shit behind and just move on.
Right.
Take learning and just move on. It's never too late to learn. From the moment of birth, and some professionals believe, and I must admit I'm one, by the way, before birth, all the thoughts, feelings, reactions, and memories are registered in the deep subconscious mind. And those memories, with the accompanying thoughts, feelings, emotions, and reactions, will last for life. So suggestions and autosuggestions are very powerful when given to a child, especially by someone in authority over them. So parents have a major role in ensuring that their child develops during their early years a positive mindset. And the Goulding process is a simple one to be able to utilize and empowers parents.
What areas of behavioral management can assist children with the ODD problem, oppositional defiant disorder?
Yes, don't you love that one? I find it fascinating that they find these very, very long words to describe a child saying no and having a tantrum.
That's right. He's angry.
Right, that's the terrible twos.
That's a
what
psychiatric
that is.
problem now to say no.
And now it's a disorder.
Yeah, absolutely. So the spectrum is actually very wide, guys, and the registered consultants around the world that are reporting back to me indicate positive results with a wide range of behaviour disorders. And health issues and dealing with education, stress or anxiety are just some of them, especially children diagnosed with autism or the autistic spectrum disorder actually do appear to be responding well to the Goulding process. The label Asperger's and autism seem to be very prevalent at the moment, and some of the case histories that I'm receiving from some of the registered consultants around the world, which there's about 70 or 80 now, which is fantastic, they're starting to report major changes in the children's social skills and behaviour management, which is very rewarding. And in fact, another area that is sometimes described as a controversial diagnosis by the Diagnostic and Statistical Manual of Mental Disorders, which of course, as most readers know, is the DSM,
yeah,
is the oppositional defiant disorder, ODD, that you mentioned, Jim.
Right.
This disorder is sometimes described as an ongoing pattern of disobedient, hostile and defiant behaviour toward authority figures, which goes beyond the bounds of normal childhood behaviour. And children who have it may appear very stubborn and angry, and
Sleep talk does appear to be able to assist this area of anxiety. Certainly the ones that I've had the pleasure of working with have reported excellent response. I think it's very easy for us to make judgments when we're outside of the knowing of the individual situations, Lynn, but I do have a sense of frustration that I know that the Goulding process, and with the positive feedback over the last 40 years we've received, that some of the that have been posted actually onto the website, especially issues dealing with aggression or behaviour management and tantrums, and children dealing with stress and fear and anxiety, and even selective mutism, which is fantastic. A case in England have responded superbly to sleep talk. It's particularly helpful when dealing with issues around education and study and a range of health issues such as asthma and bedwetting, nail biting and speech. In fact, we have a Professor Ian Brighthope here in Australia, who's a very prominent expert, has suggested that this process, sleep talk, should be developed and adopted by all parents. And he's described it as a sensible, practical and easy to follow method of communicating important messages to the subconscious mind. And he actually considers it's especially useful for affecting changes to children's behaviour. So there is an alternative to the medical situation and the medical option. The process has been described as a 2-minute gift with changes that last a lifetime. And because it's important for parents to realise that it's not what we leave to our children that matters, the bites and the clothes and the hair and the nails and all of the other things, but it's the knowledge that we leave within their minds that is so very important. It is a fantastic option to medication, and it's self-empowering for parents. And the objectives of teaching the sleep talk process to the parents were twofold. Primarily, it was to assist the children to change their perspective on life from fear to positive outcomes. And secondly, it enables communications and interactions with the family unit to both stabilise and balance. So these objectives were actually delivered within the 3 to 6 month time frame, which is fantastic. And ideally to all the children within the family unit that are under the age of 12 to 14. So fantastic alternative to medication.
What we haven't mentioned is how much that probably helps them too, because when they're giving powerful suggestions to their children, they're sitting there in a quiet, undistracted place where they're going into that same state of relaxation as they give this 2-minute gift to their children. And I'll bet that it comes back and helps them with their own anxiety and confidence issues. And
then you get 100% out of the assessment that I was going to give you at the end of our discussion. Fantastic. Well done. Spot on. That's exactly what happens. Emotional hugs are so violently, terribly important. Physical hugs are one thing, but emotional hugs, to me, that's happiness insurance. And all children need emotional hugs. All children.
Mm-hmm. And so do I.
And so do we all.
You got it. You got it.
You have been so wonderful. Thank you so much.
Just really appreciate it, Joane.
Oh, it's been my pleasure. It's been my pleasure. And I will talk till the cows come home, as you've obviously realised, when anyone is interested in my beautiful science. So thank you for very much, both of you. It's been fantastic meeting you and an opportunity to speak to your listeners. And I really value the time. So thank you both.
Thank you, Joan.